Hi, how's it going? This is Dr. Gregory Cygan. I'm talking to you today about post-op instructions. Definitely having any kind of dental procedure can be stressful, but I'm here to help you through it. These instructions are going to help you get through that post-operative period as well. So let's take a look at this brochure here. So this is the standard brochure that I'm going to provide you with during any treatment at our office, and it's going to tell you all about any instructions that you might need to know for a procedure that you might have done. Maybe you have your wisdom teeth removed, maybe you have a dental implant that's been placed, or maybe you've just had a single tooth extracted. Immediately after a procedure such as extraction, you want to bite firmly on gauze for 45 to 60 minutes. Now, sometimes after a grafting procedure or after an implant, I may specifically instruct you not to bite very hard on gauze or anything like that. If I tell you that in person, then you should remember to do that instead of following these directions, okay? Make sure not to spit, rinse, smoke, drink alcohol, or suck through a straw for at least 72 hours. Now, everybody knows that smoking isn't healthy for you, so definitely, if any time's the time to quit, it would be now. So definitely take that into account. Sometimes it's better to lay off the smoking for even 7 days, so keep that in mind. Make sure, don't spit after an extraction, okay? If you need to empty your mouth, just stand over a sink and passively open your mouth so that all the saliva or any blood or anything like that, any water might just spill out into a sink. You gotta stay clean and everything, so make sure that you do that in a responsible manner, okay? All right, next page here. So next day you might experience pain and have one or more of these symptoms. So definitely you can have minor to moderate pain. That is normal. You can have some swelling. Maybe you're going to have some puffy cheeks. You might have some bruising. Definitely that's possible in our older populations. You can have pain up in your jaw or in your ear, or you could have a sore throat. Definitely any of these things can happen. So keep in mind that that's normal. Definitely it's important to rest. You don't want to do any heavy lifting. And again, you don't want to be sucking through a straw, spitting, drinking alcohol, or smoking. Those are all things that are going to slow down your healing. Now, as far as toothbrushing, you still got to take care of your mouth. So if you're able to, definitely clean the teeth that were not treated gently. You can use warm salt water to freshen your mouth, but remember, you cannot spit. This will cause a dry socket. And make sure to moisturize your lips and make sure that you're not bleeding excessively from there, okay? So as far as like discomfort, sometimes I'll specifically prescribe you stronger pain medicine, but it's definitely possible to manage our pain symptoms with over-the-counter pain medicines like ibuprofen, also known as Advil, Aleve, naproxen, and Tylenol or acetaminophen can all help us relieve discomfort. Just make sure to follow directions regarding dosages on those packages. Now, as far as swelling goes, you want to apply a cold compress to the area. So sometimes if you take out all the wisdom teeth, it's going to be on both sides. First day, definitely that will help reduce bleeding, reduce swelling, and that usually goes away after about 3 days. But let us know, call our office if it hasn't. Now, bleeding is normal for the first 12 to 24 hours. Definitely, you might see a little bit of weeping, a little bit of oozing. If you see that there's excessive bleeding or anything like that, you can definitely bite on the extra gauze that we provide patients. And if you're all out of gauze, then definitely you can use like a Lipton black tea bag. If you feel small parts of bone working their way out, or occasionally a small piece of the tooth, that is normal to see after an extraction. The pain can be uncomfortable from that, but just keep in mind, if it's painful, it could be a dry socket. So if that happens, you can definitely let us know. But oftentimes there's nothing that changes a dry socket except for time. It just needs additional time to heal. So you may always remember, don't smoke after an extraction. That's very important. As far as your diet goes, you should make sure to drink plenty of fluids and basically stick to a liquid to a soft chew diet. You don't want to be chewing a steak or anything like that after surgery, so you definitely have to go slowly. If you had a procedure, you might have a lot of pain, so you don't want to overuse your joints or wear yourself out. Okay, so when you're still numb, you might not be able to tell that your lips are closed or if you're chewing your cheek, so you have to be careful while you're numb as well. If you have stitches, try to avoid playing with them. A lot of times I'll be using resorbable sutures. That means that they will go away on their own with enough time. If you have non-resorbable sutures, I will inform you of that, and we'll definitely have you back in the office to remove them. Just make sure not to anything like that. If you have an antibiotic prescription, it's because you need to finish it, okay? So don't misuse your antibiotics and discontinue them prematurely, or discontinue them if they're working for you. Sometimes people can have allergies to medications. If you have an adverse reaction, then definitely let our office know. We can modify your prescription, and definitely always let us know if you do have some kind of medication allergy. So that's a basic rundown of all the post-operative instructions. The most important thing is, remember, don't spit, don't smoke, don't suck through a straw. Make sure you take your medicine, the way I prescribed them. If you're going to sleep at night, you can put a towel down. Make sure that when that blood can mix with your saliva, it can be like a lot of saliva, and it just mixes, and it looks like there's a lot of bleeding, but a lot of times it's just mixing. So you just need to keep that all in mind, and for sure you're going to be fine. I'm going to take great care of you, make sure that we do a good job for you. Make sure to visit our website at dentalsurgeonsltd.com. You can always call our office at 630-765-7557. Thanks for watching my video, and have a good day. Bye.